Most people over 60 take magnesium and vitamin D3 the wrong way. If you are over 60 and are taking vitamin D3, magnesium, or vitamin K2, please listen to this very carefully, because there is an extremely common mistake that millions of older adults are making. They take these vitamins every day to protect their bones and their hearts. But in some cases, they may accidentally cause calcium to build up in their arteries instead of going into their bones. What's concerning is that this often happens silently. You don't feel anything, there are no obvious symptoms, and many people only discover it when the problem has already progressed quite far. So in today's video, we're going to talk about 3 nutrients that many people over 60 are using: magnesium, vitamin D3, vitamin K2, and, more importantly, how they actually work together in the body. Because once you understand this, you may be able to avoid a mistake that many people are currently making. 1. Why many people start taking vitamin D after age 60. Most doctors recommend that older adults have their vitamin D levels checked, and there is a very good reason for that. As we get older, the skin produces less vitamin D from sunlight. We tend to spend less time outdoors. The body absorbs nutrients less efficiently. As a result, many people over 60 have low vitamin D levels. And low vitamin D can be associated with osteoporosis, muscle weakness, increased risk of falls, a weaker immune system. So many people begin taking vitamin D every day. This sounds completely reasonable. But there is one important thing that many people are not clearly told. Vitamin D has one main job in the body. Vitamin D helps the body absorb calcium from the intestines more efficiently. In simple terms, vitamin D helps your body take in more calcium from the food you eat. Yes, that is very good for bones, but only if the calcium goes to the right place. 2. Calcium is not only in bones. Most people think calcium is only related to bones, but calcium is a mineral involved in many important activities throughout the body. It plays a role in muscle contraction, nerve signaling, heart rhythm, blood clotting, but if the level of calcium in the blood becomes too high, the body has to find a place to store it. And sometimes that place is not the bones. Calcium can begin depositing in arteries, heart valves, kidneys. This process is called vascular calcification. According to many studies, vascular calcification is associated with heart disease, high blood pressure, stroke. This does not mean calcium is bad. We need calcium for strong bones. But calcium must be directed to the right place in the body. You can think of calcium like cement. If cement is used in the right place, it helps build a strong house. But if cement is accidentally poured into a water pipe, it will clog the pipe. Vitamin K2 helps make sure calcium is used in the right place, inside the bones, not inside the arteries. And that is exactly the role of vitamin K2. 3. Vitamin K2. The calcium traffic. Director, vitamin K2 has a very special job. It activates 2 important proteins in the body. The first protein helps pull calcium into the bones. The second protein helps prevent calcium from sticking to the arteries. You can imagine it like this. Vitamin D is like the person who brings calcium into the body, and vitamin K2 is like the guide that directs calcium to the right place. When these 2 nutrients work together, the system tends to function quite well. If you have atherosclerosis, difficult to control high blood pressure, or joint calcification, it may be a sign that calcium is depositing in the wrong places and that you may be lacking vitamin K2. But there is a third piece of the puzzle that many people don't know about. That piece is magnesium. 4. Magnesium. The overlooked piece. Magnesium is an extremely important mineral. It is involved in more than 300 biological reactions in the body. Magnesium is related to muscle function, nerve function, blood pressure, blood sugar, energy production. But what makes magnesium especially important in today's discussion is this. Magnesium helps activate vitamin D in the body, and the vitamin D you take does not become active immediately. It must go through two conversion steps, one step in the liver and one step in the kidneys. Both of these steps require magnesium. If the body lacks magnesium, vitamin D may not work effectively. Some experts call this functional vitamin D deficiency. You may have fairly high vitamin D levels in your blood, but your body still may not use it properly. 5. Why magnesium deficiency is so common. One interesting thing is that many people do not realize they are low in magnesium. Studies show that a large percentage of adults do not get enough magnesium from their diet. This can happen for several reasons. Modern foods often contain fewer minerals than they used to diets that lack green vegetables, stress certain medications. Some common signs of magnesium deficiency may include nighttime leg cramps, difficulty sleeping, fatigue, irregular heartbeat, small muscle twitches. These symptoms are often mild, so many people tend to ignore them. 6. Why people over 60 need to be more careful. After age 60, the body begins to change. So one important change involves kidney function. The kidneys are responsible for filtering the blood and balancing minerals. Over time, the kidney's filtering ability often gradually declines. This means that when we supplement minerals from outside sources, the body may process them more slowly than before. That is why dosage becomes very important. Taking more is not always better. 7. How to use these 3 nutrients wisely. Many experts suggest that if you choose to supplement, thus it is best to keep things simple and balanced. For example, magnesium glycinate is often considered a form that is easy to absorb. A common amount for many adults is about 200 milligrams per day. Many people prefer to take magnesium in the evening because it may help promote relaxation and support better sleep. Vitamin D3 is usually taken with a meal that contains fat because it is a fat-soluble vitamin. A commonly used amount is about 1,000 to 3,000 IU per day, depending on the individual. Vitamin K2, often in the MK7 form, is typically taken at about 100 micrograms per day. K2 is often taken together with vitamin D. 8. Timing can also matter. Vitamin D3 and K2 should be taken with a meal that contains fat. Because these are fat-soluble vitamins, if they are taken on an empty stomach or only with water, the body may absorb them very poorly, and some may even be eliminated. Magnesium is often taken in the evening. This may help the body absorb minerals more effectively. Experts often suggest separating magnesium from high-calcium meals by about 2 to 3 hours. You can imagine magnesium and calcium like 2 cars trying to cross the same narrow bridge. If they both try to cross at the same time, traffic may slow down. But if they cross at different times, the flow becomes smoother. A small note. If magnesium comes from foods such as leafy greens, nuts and beans, there is usually no need to worry too much about separating the timing. And this recommendation mainly applies when taking higher dose supplements. An easy schedule to remember during the day. Many doctors and nutrition experts suggest a simple routine like this. Vitamin D, K2 and calcium, if you take it, leads to with a main meal, lunch or dinner. Magnesium leads to in the evening, about 1 to 2 hours before bedtime. This approach has 2 benefits. 1. It may reduce competition with calcium during absorption. 2. Magnesium may help relax the muscles and support better sleep. 10. An important note about medications. If you are taking blood thinners such as warfarin, you should speak with your doctor before taking vitamin K2. Vitamin K can affect how this medication works. This is why talking with your doctor is very important if you are taking prescription medications. 11. Don't forget about diet. Supplements should only complement a healthy diet. Magnesium is found in many foods such as leafy green vegetables, nuts, beans, whole grains. Vitamin K2 can be found in foods such as eggs, cheese. Fermented foods. Fermented foods are foods created through a natural process in which beneficial bacteria transform the ingredients. Some common examples include natto, fermented soybeans, one of the richest sources of vitamin K2, sauerkraut, fermented cabbage commonly eaten in Germany, kimchi, a traditional Korean fermented cabbage dish, among certain aged cheeses, especially hard cheeses such as Gouda or Brie, yogurt and kefir, which are fermented dairy products that contain beneficial bacteria. These foods not only provide small amounts of vitamin K2, but they also support the gut microbiome, something that becomes increasingly important for overall health as we age. However, many people do not eat these foods regularly, which is why some people choose to supplement vitamin K2 through dietary supplements. Vitamin D can come from sunlight and fatty fish. A balanced diet usually helps the body obtain more nutrients naturally. Conclusion: imagine calcium as water. Vitamin D is like a pump that helps bring water into the system. Vitamin K2 is like the network of pipes that ensures the water flows to the right place, the bones. And magnesium is like the electricity that powers the pump. If there is no electricity, the pump will not work. So in simple terms, vitamin D helps the body absorb calcium. Vitamin K2 helps move calcium into the bones instead of the arteries. And magnesium helps vitamin D function properly. When these three elements work together in balance, the body can use calcium in the most beneficial way. Before you leave this video, try doing one small thing. Tonight, take a look at the vitamin bottles you are currently using. Check whether you are taking vitamin D. And if you are, ask yourself whether your body may also be getting enough magnesium. Sometimes a small change can make a big difference for long-term health. If you found this video helpful, please press the like button so more people can see it. And if you care about keeping your bones, heart, and muscles strong after age 60, subscribe to the channel so you don't miss the next videos. Take very good care of your health.